Hi, my name is Erin. I am a registered nurse currently and have been for the past 3 years. I am also an NP nurse practitioner student, and I am also somebody who was recently diagnosed with papillary carcinoma, also is a type of thyroid cancer. I was diagnosed back in June 22nd of this year, 2022. Little bit background. Well, first off, I'm 25 years old, so I am young. Not many young individuals in general are diagnosed with cancer. And that is the primary reason why I am starting this channel. Never in a million years did I think that I would be starting to make videos for YouTube. But my mom thought it was a good idea. So a little bit of background of how I found that I had thyroid cancer. So since I am in NP school, back in January of this year, 2020, I was learning how to assess the thyroid in my health assessment class. And I was learning how to assess the head, neck, and throat. So, as you know, anybody would, I was doing an assessment on my own thyroid when I was reading. And I did notice, I don't know if you can see it, you could see it here, a nodule on my thyroid. And I couldn't really tell if it was on my thyroid or if, it was a muscle. And I was telling myself, oh, well, I feel a little something on this side too. It is symmetrical. So months went by and it was always in the back of my head. Of course, I did my Google search and I saw that, yeah, it's probably a thyroid nodule, but a lot of people have them and don't even know. I just happened to feel mine. And I don't have any symptoms of any cancer. Of course, that's the main concern. And so I eventually went to go see my primary doctor about it. I thought, oh, it can't hurt to go get it checked out. So I went to my primary. I had to tell him exactly where I felt it because you can't see it by just looking at me. Went to him, I told him, I'm not losing weight, I'm not coughing, not having difficulty breathing or swallowing, it's not bothering me, it's not painful. So in that case, I feel like it's a lot harder to go seek any medical attention because it's not affecting you and not bothering you. It's just the mental thought of the fact that it's there. So I'm glad I went, and that I probably went to him maybe in like May. So I found it back in like January, and I had an appointment with my primary to just get it checked back in May. And so he sent me for an ultrasound. A few weeks later, got an ultrasound of my thyroid and my neck. Came back that there were 2 nodules that were found on the right hand side. One of them I felt, and then one is one you can't even feel or see, which is right underneath it. So since they found 2 nodules on my ultrasound, I went for a biopsy. Went for the biopsy, maybe this is around, I think it was like June 17th. So I went for that. Thyroid biopsies are not the most fun. You are awake for them. It's a minimal procedure in a way. It's sterile. A PA did mine. There's other people in the room. There's a cytologist in the room. The whole process took about an hour and 15 minutes. It's not the most comfortable thing. I was fortunate. The nurses, PA, the ultrasound tech that was in there, they were super nice, and they were just having normal conversation. They were talking to me like I was one of their friends. And so they go in and out of each nodule during the biopsy with very fine and small, long needles. They go in and out of each nodule that you have. So I had 2. They went in and out 3 times in each one after getting this, and that's how they get a full sample. If they need any more, like they did for me to get more of a sample, they went in a 4th time in one of my nodules. So they go in and out the 3 times. They give it to the cytologist that's in the room. They're the ones that look at the sample underneath the microscope, and they say right then and there if it's a good sample to send over to the lab to get checked out. So I had 3 passes in one nodule and then 4 in the other nodule. They do numb the outside of the skin with lidocaine. Definitely helped a lot. But you definitely, I mean, they're right there. You know what they're doing. You know when they're going in, but it's eventually over, and it's just a little sore for the rest of the day. That's it. There's really no risks of getting I'm sure there are, but very low risk, and overall it was a simple procedure. So I had that biopsy. That was on a Friday, end of June. Next week comes around. I was off from work that following Wednesday. I was doing my homework and I was closing my laptop. This was like the afternoon, like 2 o'clock or something. I was closing my laptop. I said, I'm going to go to the gym, relax, and then I'll hit the books when I get back from the gym. So I closed my laptop. I got a call from my doctor, and I kind of knew as soon as the doctor was on the other end of the phone that it was probably not news that I wanted to hear, because usually if something came back negative and fine, a nurse or somebody like that would call and just say that everything's fine and there's nothing else needed. So the doctor called me, and he said, this was on June 22nd. So he called and he said, yeah, so we got your biopsy results back, and yeah, so they did find cancer. And this whole situation was once he said that C word, everything else was sort of a blur. I remember bits and pieces of it, and he said that it's papillary carcinoma. I think there's 2 different types of thyroid cancers. Papillary carcinoma is one that I have. It's the most common one. He said it's very, very treatable. We got this. This is the name of the surgeon. I want you to make an appointment with him. He's a great thyroid surgeon. You'll most likely have your thyroid removed, be on medication, and live a normal life. But it's good that we caught this. And that was it. And I was home alone. My parents were out of the house. I live with my parents, by the way, saving up money. And I was sad. I was really sad. I didn't know the prognosis of thyroid cancer. I didn't know anybody personally with it. And all I heard was, you have cancer. And so many things were running through my head. I was just thinking, I'm 25, I have school to do, I have a life ahead of me. I have so much more to give. So I called my parents right away. They didn't answer. So I called my current boyfriend, who is deployed all across the world. It was 12 or 13 hours ahead. And I called him. If he was asleep, then he wasn't going to answer. But unfortunately, I did kind of wake him up, and he answered. And I apologized for making him lose that much sleep. And at that moment, I just needed to let it out and talk to somebody and tell somebody. I couldn't just sit there, and I wasn't gonna Google it or anything, because I was just gonna freak me out even more. So I told him. He was totally shocked. He didn't get any sleep that night. I felt awful. How could he, after I just told him that? And eventually my parents called me back, and they came back from wherever they were. They got back maybe 45 minutes later and talked to me. I broke down when they got home, and it was my life just kind of changed in that moment. And being told any sort of diagnosis, that's kind of what happens. Your life can change at any moment, not just a diagnosis, anything. Winning the lottery, that's a good thing, but that could change your life too. So they came home, we talked things through. They were Googling it and researching it. I said, I really, like it, I don't even want to see the words thyroid cancer. I don't want to look into it, which I totally would recommend for people as eventually look into it, but I wouldn't recommend just researching things out of the blue, because it will stress you out, and I knew that would stress me out, so I just didn't. All I heard was, you have cancer, it's a good prognosis, and that's what got me through that day. I did some more homework. I had an assignment due that night, so I did my homework. I needed to keep my mind off of it. I couldn't just sit there and think about it. And I did end up going to the gym, did some cardio, went on the treadmill, I think, did some lifting, and I came home and did not sleep that night, but how could I? And I went to work the next day, and I told my work, I told my boss, I work at an outpatient IV clinic, and I told, my coworkers there, and I was fortunate enough to do some treatments there, IV treatments, before the day started, before any of our patients got there, so I did feel better. I've always been very healthy, exercise. I vegetable salads every day. I eat a lot of whole foods. I watch what I put in my body. I watch what I put on my body. And I've not always been like that, but more recently I've been like that because I do work at an alternative medicine clinic. I am certified in holistic nursing, and I know that there are a lot of external factors that affect the body and the cells in the body. So from being told that I had cancer on, I was just very strict with the things that I was putting in and on my body. I was eating salads, like plain things, no dressing. I'm definitely more lenient now. So yeah, that's kind of my whole diagnostic story. Fast forward about a month, I went to my first appointment with the surgeon that my primary recommended me to, and it was scary. I went with my dad. I definitely recommend bringing some sort of support with you, somebody to go with. I went to my biopsy with my mom. Definitely recommend going with somebody there. She drove me home. You can drive after the biopsy. I would recommend just having somebody go with you, just for some support. And so went to the appointment with the surgeon, and he did an ultrasound right in the office of my thyroid. He said, yep, it's definitely, consistent with papillary carcinoma. And he did say that one of my nodules was very close to my trachea, meaning that, I'd probably find out about it maybe in my mid-30s or so, when I would have difficulty swallowing or breathing. If the nodule were to get bigger. And he did say that it looks like a nodule may have spread to muscle in the neck. And he also saw an enlarged lymph node on the right side up here. So, not great news when I went to go see him, but it's all things that I need to hear. I can't just not know what's going on. And he was very blunt with everything too. So definitely recommend bringing support with you. I was not in the mindset to ask a lot of questions. My dad was asking questions. I was just trying to take it all in. So since he did see that enlarged lymph node on the right hand side, he sent me to go to get an ultrasound called a lymph node mapping. So it's basically an ultrasound of the neck area where the lymph nodes are on both sides. So I went for that later in the day. He did one there, but he wanted me to go to a place and get an official one. So later that night, I made an appointment at a place and I got it there. And he also wanted to do a biopsy on the lymph node. So there's more. So the following Monday, I had to take off from work and I went in to go see that surgeon again, and he took a lymph node biopsy. It was a lot quicker than the thyroid biopsy. He did it 1, 2, 3. He did the 3 passes. He numbed it and everything. It was just a lot quicker. It was maybe 10 minutes. It was very quick. results for that take 1 to 2 weeks. In the meantime, he wanted me to find an endocrinologist. I went to the one that they referred. Went to him about a week later, or the following Friday after my lymph node biopsy, and that doctor, the endocrinologist, was actually able to see my results of the lymph node biopsy. There were 2 markers, I forget the names of them, but both of them came back negative, which I was happy about. At least there's some good news. With some bad news, there's got to be some good news. And so met with him on Friday, and he was explaining, as well as the surgeon, there's different stages. I forget the name. Bethesda. I had to stop it for a second. Bethesda. There are levels of the biopsy results, and it's 1 through 6, and they're called the Bethesda levels, or Bethesda scores. Mine came back after the biopsy a level 5. 5 meaning that there's roughly a 70 or 75% chance that the nodule is malignant. 6% is like 99% chance that it's malignant, and like 1-2 is that it's benign. Like there's barely any chance of it being cancerous. And of course, finding this made my parents a bit concerned, as well as myself, because I'm like, I don't want to lose my thyroid if it's not cancer. So this was actually something that we discussed with the surgeon, and he did say, you know, one, it makes it closer to 100% that it is malignant due to what he sees in the ultrasound. He did show us the ultrasound, but ultrasounds are tough to look out if you don't really know what you're looking at. And he's seen hundreds and thousands of them, so he knows, you know, what looks malignant and what looks benign. So the biopsy, Bethesda level 5, plus my ultrasound imaging, it's cancer. So also what he said was, you know, of course, a question my dad asked was, you know, why can't we just take, you know, the thyroid nodules are over here, can we just do a partial maybe? And he said, well, one, you'll be on thyroid medication every day for the rest of your life anyway if you get a partial, and it would be the same thing with a total thyroidectomy. And 2, you have Hashimoto's. So a little backtrack, I did lab work at my work, and I found that I had the antibodies for Hashimoto's. I never knew I had a Hashimoto's, but I have it. And the surgeon was actually able to look at my ultrasound and tell from my ultrasound. I don't know what he sees on it, but he was able to see that I had Hashimoto's, and he basically said, you have Hashimoto's anyway. Your thyroid's not working anyway, so you'll have to be on medication either way. So it's safer and the cells can spread, which scares me. So the safest thing to do is to do a total thyroidectomy. So that's the plan. I met with the endocrinologist, and so that surgeon I saw twice, he moved to a different facility, and I couldn't get an appointment with him until mid-September, and then my surgery would probably have to be, it would be later than that. I kind of want to move along with this and not wait any longer, because the longer I wait, the longer I think about it, it's going to stress me out, and I'm just thinking of it spreading, even though it spreads very slowly. So I ended up meeting another surgeon at this hospital. It's a great hospital. Met with him a few weeks later, and he discussed the whole process of the surgery. I looked him up when I got home, and thyroid surgery is all that the surgeon does, which makes me feel very comfortable. He was super nice. He explained the risks to surgery, including obviously bleeding, infection, which is very slim chance, as well as the potential to irritate the parathyroid, which are glands right behind the thyroid, and they're in charge of calcium regulation. So when those are touched or irritated or damaged in any sense, your body has trouble making calcium, and you would have to be on calcium for the rest of your life. Even though these are scary things that the surgeon has to explain, they need to be talked about because they still are risks. Just like how we don't know the sun is going to come up tomorrow, but it probably will. Slim chance that it's not. So I met with him about, it was last Friday. Today is Saturday, August 13th. I'm looking at my calendar. And so I met with him on Friday last week, and this past week I called them up. I said, yes, I want to schedule surgery, and it got scheduled for August 17th, which is just a few days away. It's on Wednesday. And so yesterday, on Friday the 12th, I went in to meet with the surgeon again, go over everything, the process. He has me stay in the hospital that night just to monitor, and he'll discharge most likely, as long as everything's okay, the next morning, and which I'm totally fine with, staying in the hospital. A lot of surgeons, it's you go home the same day of the surgery. I got no surgery for a deviated septum like 6-7 years ago, and I had a rough recovery with that. It was barbaric. I mean, now I'm fine, but the whole recovery for that was god awful, and I wish I stayed in the hospital after that surgery. I should have. I didn't stop bleeding for like 3 days. So I'm fine with staying in the hospital as long as, you know, I'm okay and I can leave the next day. I'll feel comfortable that I was told that it's okay for me to go home. He just said that I might just have a sore throat because there'll be a tube down my throat during the surgery. He said the surgery takes about little over an hour. I think he said like an hour and a half maybe. Yeah, so not a huge long surgery. Another risk he mentioned was the potential of damaging the vocal cords, which is less than 1% chance of that happening. But again, that's something that he needs to explain because it is possible. And he also explained that there are ways he can trigger the vocal cords during surgery. to just make sure that they're okay and not damaged. So yesterday I signed the consent forms. He had me go get some blood work. I believe it was a CBC, and type and screen. So they need to know, your basic lab work and your type and screen, which is your blood type, because just in case you need a blood transfusion, this is something that is needed for all surgeries and procedures. So I went downstairs after I met with him, got that blood work done, all good, and they said that on Tuesday, the day before my surgery, I will have somebody call me, and I think the nurse coordinator or the PA that's working with the doctor will call me and tell me exactly what time to go in and the whole process. So yeah, that is where we are now. Next time I'll see the surgeon is the day of my surgery. So that is my whole spiel on my diagnosis, and I am putting these videos out there to help share my story and this journey of a 25-year-old that was diagnosed with thyroid cancer. And a lot of times we think that what happens to us is not fair, and we can think that all we want because it isn't fair, but it's life and we never know what life's going to throw at us. I like to believe that what doesn't kill us makes us stronger, and this is just something that needed to happen to me to build me as a person and make me stronger than I have been stronger. When you're diagnosed with something or something happens to you, you don't really have a choice. You have to be strong because you still have to get through every day. I'm still going to work. I'm still seeing friends. I'm still going to the gym. I am still going to school. And there was a part of me that wanted to take off from school or not go out and see friends and not do things and not socialize. But I knew that was a path that I didn't want to go down, because once I start doing that, it's very difficult to get off track. And I kept thinking, I could have had this for a year or two and not even known. And the only difference between who I was before that phone call and right after that phone call was the fact that I knew that I had cancer. And that's it. Physically, I was the same person. A lot of it is mental and how we look at things. And I look at life now as something so special and something that I'm not going to take for granted. I wake up every day so happy that I'm able to walk and live and drive and go to work and go to the gym, and I have friends and I have family, and I'm so thankful for everything that I have. So that was my whole talk on my diagnosis, and I hope I wasn't too boring. I am going to once in a while get on here and talk. I've always loved to cook. I'm not a huge baker. I'm not that great, because with baking, you have to measure a lot of things, and the more I have to measure things, the more things I have to clean at the end. So I don't like to do that. And it's messy too. Not that cooking's not messy, but anyway, I love to cook, and recently I've been trying to make just good things that are healthy and organic and natural. And you know, healthy foods don't need to taste bad. So I'm constantly looking for new ideas and new things to cook with. And I'm really trying to stay healthy. Ever since I found out I had Hashimoto's, I found out back in March that I had Hashimoto's with the lab work. And ever since then, I've been dairy, gluten, and soy free. I thought I would never be able to do that. I started off with no gluten, and then I transitioned. Once I was good with no gluten, then I started going into dairy and soy. I don't really eat anything with soy. Soy's in a lot of vegan products. I'm not a vegan. And I've been feeling really good on the gluten, dairy, soy free lifestyle. I'm not going to call it a diet, lifestyle. And so yeah, so I'll be coming on here either to talk about my journey throughout all of this, or I'll be on here to share some cool recipes that I've found. And if you guys have any questions about anything or would like to talk about anything, please just let me know. I'll talk about nursing school, nursing jobs. I could talk about NP school or anything medical related, anything like that. I know it was a little bit longer of a video than I wanted, but I am glad that you stayed till the end, and even if you fast forward, and I'll probably make my next video not at the hospital, after I get back from the hospital next week. And that's it. Thank you for listening.